Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I am your host, Daniel Marino. Over this past year, and probably for the last couple of years, hospitals and health systems are still focused on improving their financial performance. And they're really doing it in a couple of ways, right? I mean, you're focusing on trying to create more volume. Of course, you're limited by the reimbursement that we get from payers, but we're also focused on reducing cost. And cost reduction through performance improvement or quality improvement has been a pretty significant initiative. Of course, driving financial performance for hospitals and health systems is really based on your surgical services. Surgical services, perioperative services, whether it's in the hospital, OR, or the ambulatory surgery center, accounts for anywhere between 55 to maybe 75% of overall revenue. It's considerable. So the focus on creating efficiencies in your OR through making sure that your on-time starts are occurring on time, turning around your rooms efficiently, preparing patients, both pre-op and post-op, all of those items go into the efficiency and impact your revenue as well as impact your cost structure. And of course, the alignment between the hospital and the surgeons is really an important factor in making that happen. However, when you look at what it really takes to drive that performance, the nursing support is really the key, in my opinion, to driving that success. And having strong alignment with the nurses that bridge the gap between what's required within the hospital and health system and leadership and with the surgeons is really what then drives the results. But it's a difficult role for nurses. And many nurses find themselves in a predicament where they have certain requirements of the hospital and leadership, but patient care requirements for the surgeons. So here to talk about that is a senior level nursing executive, someone I've known for quite some time, Cindy Mahal. She is the Chief Administrative Officer for a large health system in California. Cindy has held numerous leadership roles, including nursing leadership in surgical services and in other areas of the health system. She's also COO and in charge of the vision, operations, and strategy for a large system in California. Cindy, welcome to the program.
Thanks, Dan. Thanks for having me.
So Cindy, as I mentioned, oftentimes what we see, and I hear this a lot, either from the surgeons or from leadership, that the alignment of the surgeons with the vision of where the hospital wants to go around perioperative services or surgical services is critical. But really the key in making this work is nurses. And nurses they're challenged with this, right? And I think for a whole host of reasons, which I'd love to dive into. But why do you think that nursing oftentimes, as we think about making those changes, why is there such a challenge for nurses? Why are they placed in this difficult role?
Yeah, and I think from a nursing perspective, when you talk to the nurses at the bedside, really they're balancing patient safety, which should be our priority, with efficiency. Right. And they also want to find meaning in their work. They don't want to be this factory worker who's being pushed to go faster or focus on metrics. They want to focus on patient care. So it really puts them in a very difficult spot. They do know that, surgery makes money. So you're part of that machine and you have to accept that. But you also want to be able to make sure you are focusing on your patient. So, and we know surgery is an extreme sport, right? that is an extreme team sport where everyone has their role and we all have to work together. And each of us have competing priorities. So I think nurses are put in a tough spot to get what we need for the patient, for the physicians, and for the organization.
We've been part of a number of perioperative improvement engagements in some of the consulting work that we've done. And governance is always a really an important part of that, right? And what we see as part of that is that that's where leadership and the surgeons have to come together to create the common version of process or performance improvement. But then it's really led and directed by the nurses. What do you feel like the nursing role should be in driving that change? How much influence should they have or do they have in working with the surgeons?
Well, nurses have to be at the table, right? Because we're the ones getting I hate to say it, getting the work done and seeing the big picture of what everybody needs. So you have to get their buy-in. You have to be able to say, what are the barriers from your perspective? Because the physician will tell you their barriers. They'll say, oh, it was a 40-minute turnover, when reality, it was 25. You just weren't in the room for a significant portion. But, talking to the nurses to find out what could we do to help them meet this target in reasonable, right? I mean, you'll get things from, well, we need 5 more of this, or give me a reasonable solution to kind of help you. So really bringing nurses to the table, explaining to them the value of why we're doing this, right? We are very common sense people. We understand the whys behind things if it's explained to us in a proper manner that the OR is your cash cow and we need to keep things going in order to keep this organization going. And so be a part of that, be a part of the success, and, we'll highlight you. So I think that's really important.
Sometimes I think surgeons can be a little difficult to work with, right?
Just sometimes.
Just sometimes. And do you see situations where, for those challenging surgeons, the nurses kind of put in the middle of this, right?
Yeah.
How do you deal with that difficult surgeon, who, wants to do it their way? They may have a number of reasons for that. So either their practice style, or maybe they're extremely, they have just a real busy practice. What do nurses do? They're like stuck in the middle.
Yeah. And I think, those are the best ones to start projects with, because if they're a success, then you've got them, and others will say, hey, if so-and-so can do it, and I know he has his or her routines, then it must be something I need to get on board with. So first of all, working with that surgeon to seek to understand why won't you participate with me? Help me understand, because this is going to benefit you as well and your patient. So really trying to get the buy-in, and bringing that group together and seeing what the win is for each of them. But I do like, tackling that difficult surgeon and saying, you're going to do this with me and we're going to be successful and you're going to see a benefit in the end. And I need your partnership, right? Pleading to them for that, because they do want to partner. We all have the same goals. We may articulate them differently. But I think, seeking their partnership, working with them, explaining to them what the nurses are doing and why, because sometimes they may not understand that, or there's state requirements why the nurse must do this or must ask these questions or take time with the patient.
Well, and maybe to your point, maybe the surgeons don't really recognize all that, right?
Yeah.
I mean, they're really busy and they're focused on, again, taking care of the patient and performing the procedure and probably getting in and getting out as quick as they can. Or, there could be other influences there. But I think, when I think about performance improvement and I think about that level of support, there's a couple of really important elements that come into play that drive that success. I think one is the operational support, that if nurses are leading this, and they should, or be a significant contributor, having that right level of operational support is so critical. But then having the cultural change the support as well too. What role should administration play in supporting maybe the nurses or the process in ensuring that that right level of both operational and culture support is occurring.
Yeah, and again, as leaders, we have to lead by example. And I think that is key. And from an administrative perspective, again, seeking to understand why can't we get to this target, and what can I do to help the nurses get to this target? I think that is something that's really important. And not treating people as if they're not wanting to do the right thing, right? Giving them the benefit of the doubt to say, we all have pride in the work we do. So why wouldn't I want to be, the most efficient and the highest quality OR around? Of course we want. So people do want that, and for administrative to be supportive. And if we do have barriers, helping us break it down, right? Helping them break down why we have this barrier, and letting them know, giving them the kudos when they do have some small wins. I think that's really important. Rounding in those areas. If we know we're kicking off a on-time start project, from an administrative perspective, be around, be visible, show your support. So that way the nurses and the physicians all know that you've got administrative support for this as well. I think that's really important.
Well, and that's such a good point. I think administration has to be visible, right? They have to be visible and at least be able to show that support, because as we've talked about, and I've heard this from many nursing leaders, they sort of feel like they're on an island sometimes on their own, and you can't just do it on their own, right? This has to be a team-based approach, and it's difficult. It's difficult whether you're managing the culture change, the operational change. There could be a whole host of reasons that are influencing it. If you're just tuning in, I'm Daniel Marino, and you're listening to Value-Based Care Insights. I am here today with Cindy Mahal. She is a Chief Operating Officer of a large health system, a seasoned nurse executive, and we are talking about the nursing support, or enhancing the nursing support that is required as organizations go through improvements in surgical services. Cindy, I want to get back to kind of the role of the nursing leader, if you will. When you think about surgical services, and you think about the services that are occurring either in the ASC or in the hospital OR, you'll have the director of nursing who's in the OR, and then you'll have the OR nurses that are included in there. How should that team work together, come together to support any type of perioperative improvement process?
Well, they have to be a team, and they have to be able to be empowered to take chances, take risk, right? And really put themselves out there. And then as an executive leader like myself, I have to be there to give them opportunities to shine, to excel, to build their confidence, because it is a tough OR. OR is a tough environment to work with. You've got a lot of competing priorities, a lot of big personalities. So as a nursing leader, it's my job to support them and create that, I'll say, psychologically safe environment where they can come to me with different things, as well as empower them to make mistakes. Hopefully they don't, but feel confident enough where if they do make a mistake, they're going to be supported. So we have to grow our own leaders, because leadership is tough. People don't really want to take on that 24/7 responsibility. You never know what's coming at you. You're dealing with a lot.
As you mentioned, you have to have what I would call maybe the junior nurses really engaged in the process, right? I mean, if they're part of the improvement process, the perioperative process, if they're being held to the same standard, if they're part of the outcomes that are being measured, then, again, they feel like they're contributing to it. It's a growth area for some of these junior nurses. But I also feel like some of these folks that are actually in the OR doing the work, I mean, they've got the answers, right? They know some of the things that could either are creating bottlenecks or challenges in the OR. Engaging them is just so critical. So, In your experience, when you put forth a lot of perioperative improvement initiatives, talk a little bit about the type of teams that you've created that has focused on engaging the nurses. So in such a role that, you're hearing from them and they're part of the process.
Yeah, and I think part of that, again, we talked about being visible, being rounding, being available, watching what they're doing, watching their struggles, but also giving the nurses opportunities to be able to highlight their knowledge base and building them up. So simple example, if we're working with a supply chain meeting and they're talking about orthopedics, having that orthopedic team leader on the line and letting her be there to explain the whys behind certain choices, or giving her the ability to shine, to be quite honest, amongst her peers. So that way you can build their confidence and they can take on different things. Having some of the team leaders also take on certain projects, right? I think that gives them an opportunity to be able to learn different skills, expose them to different leaders in the organization as well, so they can grow and see which leadership styles and tips they like. But I think really giving them opportunities. And when I pick my team, I pick people who, first of all, are hungry to learn, right? I will teach you whatever you want to know, and people who want to grow.
That's great.
You see it, the people who are looking at you, engaging and asking questions. And then sometimes I'll pick a naysayer just because I want to say, yeah, if I can turn this one around, then, others will follow, right? Just to give them that exposure.
Yeah. I like that philosophy though, of getting the staff, the nurses involved that are hungry, right? That want to learn, because boy, they can, that's a great way of changing the culture.
Yeah.
So when you think about perioperative services, when we've worked with a number of organizations, we looked at a couple, you look at a couple of really key statistics, right? You look at block utilization, first case on time start. That's a big one, right? Because if you don't start on time for that first case, you sort of have a trickle down effect throughout the day that's hard to pick up. And then turnaround time of the rooms. So when you create those, let's say, overarching macro statistics that are affecting the overall performance of perioperative services, have you in the past parsed out specific KPIs for your nursing team that says, look, in order to achieve, let's say, the turnaround time that we need of these rooms, as a nursing team, we need to do this? Have you gotten to that level, or are they held responsible to those larger macro key performance indicators?
A little bit of both. We've tried, when we had the key performance measures for turnover, because that was one that I really focused on, because that can be a lot of downtime and a big physician dissatisfier. Really working with the teams on redesigning the support they needed and having those nurses involved in that. What is it going to take? What can we do to do that? We did that for a couple years, where that was part of their performance review, right? Did they meet that metric? But it had to be tangible. Again, just like, when I have a goal that I know there's no way I'm going to meet that, right? So how much energy do you really give to it? So really making that, having the goal, and then potential little bit of a stretch goal to see what we can do, to give the team a little something to rally around. We've also tried other metrics, where and I've gotten this from my other AORN leaders when we meet annually, to talk about different team concepts where you could incentivize teams and have goals for specific teams, physicians and nurses, your non-licensed practitioners in the OR as well. How can we all work together to get this turnover to where we need it to be, as well as the on-time start, and then creating some sort of financial incentive. And it's not huge. It's not like we're throwing millions of dollars, but at least it's something to show
that kind of
value.
Rewards behavior, right? Rewards the work that you're putting in. Plus, it gives you an opportunity to celebrate the successes.
Yeah.
So I agree with you.
Right? You're building a team, and everybody wants to be part of something. And if you're part of this team, and you're really kicking it out, you can see it. When you walk down that hallway, you know which teams are doing it and which teams are not, right? They're together. Okay, I'm going to get the patient. Okay, you go get this. You know, you get that. Okay, anesthesia, are you ready? Yeah, I'll meet you there. So you see when it's humming.
Yeah, and you're building that excitement. And
Yeah.
I agree with you. And I think an important point that you brought up, which I think is really critical. Again, I've done numerous performance improvement engagements, and I always believe that if you can't measure it, you can't manage it, and you need to have goals, right? So I think for perioperative services, if you have a team goal and you have indicators that are being measured, and then you have, say, surgical goals as well as how you're measuring, but then nursing goals and indicators at how you're measuring, then all of a sudden, all of those pieces, that behavior, that the work, the performance improvement, you're tying that to some type of an end goal, right? So
Yeah.
to kind of like that shining star. And then not only does it allow you to ensure that you're moving at the right pace and achieving what you want to achieve, but you're able to celebrate the wins, which frankly, I think doesn't happen enough in a lot of the work.
I agree. Or we celebrate quickly and then we move on, right? And I think I don't know, that's because we're just in such a fast-paced
We are.
environment and high intensity. So we forget.
We do. Yeah. And I'll tell you, it's good to sit back once in a while and just, celebrate the wins because, it's a hard business that we're in. And as you said, it's stressful, and especially for the nurses. I give a lot of credit to the nurses who are placed in these difficult roles because it is stressful, no doubt about it. So, for any of our listeners, for folks that are tuning in, and, as I said in my opening comments, many organizations, and I would almost go so far as to say maybe all hospitals and health systems have some opportunity one way or another to improve perioperative services. And again, nursing is so critical towards achieving that goal and making that happen. Any piece of advice come to mind where organizations should start, or how they should better align their nursing team to accomplish some of those goals?
Well, I think they have to have them at the table, right? I think I've been from the bottom to the top, so I know what it's like to be in that boardroom where someone is setting that goal for you. And you're like, wait, hold on. Right now we've got 25 nurses in orientation and we've got this and that. And, this is not the time to do that. So really making sure that you have nursing at the table to understand what's going on there and in the culture to help them. But
Yeah.
listening to the voice of the nurses, what can we do? Where's our biggest problem? What can we do to get a couple quick wins, right? I think you want to at least kick off a project, not taking on the biggest monster in the room, but at least taking on a few little things that can really help you. Having a retreat. I've done that before when I kicked off big projects.
Right.
Let's have a retreat, get all the key stakeholders there, and let's hash it out in an environment that is not in the workplace, where we can talk about it and people
It's a
feel
safe
comfortable.
environment. I love that idea.
Yeah, I think
love
that
that
really
idea, because
that has
then,
helped.
yeah, it gives you a great opportunity then to brainstorm, to feel comfortable, in a safe place where, you can talk about not only where we want to go, but identify the barriers, which oftentimes the challenges and barriers, many folks know it, but they're afraid to verbalize it. And I think if you're in a safe space in a retreat, great place to do it.
Yeah, yeah. And then I always throw in a little bit of leadership development as well. We'll talk about crucial conversations, or we'll talk about how to create a culture of psychological safety. So it helps them, so they walk away with a little tool for their toolbox as well.
Yeah. And then the other one that I would add to that, and you mentioned it earlier, is making sure we have the administrative support there. Because I often do feel like, in talking with many of the nursing leaders, if they're faced in a difficult challenge, they have to turn to somebody, right? There has to be levels of support there, because it is a difficult role. And sometimes they're faced with some real tough challenges, whether it's issues of patient safety or understanding, how to begin to build the right culture of change. All of those things, that administrative support is really key.
Yeah, and I've been lucky because I've had even our system COO come to our retreats when we've had them, or the presidents have been there to show support. So I think that's key.
Yeah, that's great. Well, Cindy, this is fantastic. And I appreciate you sharing your insight. This has been really, really valuable. If any of our listeners are interested in connecting with you, I'm assuming you're on LinkedIn.
Yes, I'm on LinkedIn. It's Mahal, Cindy. So please reach out to me. Love to chit chat and help whoever I can.
Good. Well, and a special congratulations to you in your new role. I know it's, kind of a big move for you to relocate, but I know you're going to do great, and you've got a lot of great expertise and experience under your belt, which I'm sure you're going to draw off of in your role as you move forward.
Thanks, Dan.
Thanks, Cindy. I really appreciate it. And to you, our listeners, thank you so much for tuning in. Until the next insight, I am Daniel Marino, bringing you 30 minutes of value to your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the programs page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.